Botox or filler? If you're starting to see some changes in your face and you're not really sure exactly what's causing it or what the answer is, but you don't like it, and sometimes you may not know whether it's an issue for Botox or an issue for filler, what's the difference between them? Hopefully this will help clear it up a little bit. Botox is good for relaxing muscle movement or muscle contractions. And where it's really great for most people is in the upper face. I think of like the eye line and above. So frown lines, forehead lines, crow's feet. There are a couple of things that we can do with Botox or neuromodulators in the lower part of the face that work pretty well for some people, but where it really shines for everybody is frown lines, forehead lines, and crow's feet. In the lower face or below the eyes, usually lines and wrinkles are caused by volume loss, and the fix is fillers. So as we're aging, we're all losing volume in our face, mainly fat, but we're also losing bone. And all of that is what keeps our face nice and full. As we lose that, our face starts getting thinner and leaner, but the envelope or the skin is the same. And so as we're getting volume depletion in our face, everything kind of starts to fall or sag downward and forward. Now, a lot of people think that's gravity. It's not gravity. It's volume loss, fat and bone. And what can you do about it? Not a whole lot other than filler. Filler fills it back up. So a lot of people will come in the first time that they come to see me and they'll say, I need Botox in these lines. Well, Botox is not going to do anything for these lines. This is called the nasolabial fold, from the nose to the lip, nasolabial. And that's often the first sign of volume loss that people see. The answer is not Botox or one of the other neuromodulators. The answer is filler or volume. And the answer is not to put the filler in here because that tends to make your face look really full. You'll look, it's kind of a monkey face look. You kind of look like an orangutan. Think about orangutans and how they have this big, full, round area right here. That's not what you want. It doesn't look natural. We can make this line go away by putting filler in there, but it doesn't look good. So really where you want the filler, if you're seeing these nasolabial folds increasing, where you want the filler is up here. If I do this, I can make this go away completely. Now, you don't want it to go away completely. Even 10-year-olds have one of these. If you make it go away completely, again, you look kind of weird. But you want to decrease it. We have 5 big fat pads in our cheek on the surface area, and then another big one underneath. And then we also have the zygomatic arch or the cheekbone here. And all that is creating a lot of volume up here. We lose it so slowly, it's so insidious that you really don't even notice it. But one day you start seeing these and you go, where did this come from? Well, it's because you've lost your cheeks and your cheekbones. So if you ever stand in front of the mirror and you're going like this, if I could just make my ponytail tighter, basically that's what filler will do. We can put it in the cheeks and along the cheekbone, and you may not need any at all in here. Once I've done this and replaced this volume without making you look overdone, then sometimes I can put just a tiny, tiny little bit there in the nasolabial fold, but usually we don't need any. This gives you a whole lot more bang for your buck because not only does it give you your cheeks back, again, not crazy cheeks, but your cheeks, the ones that you had when you were young. So not only does it give you your cheek back, but it also lifts this and it lifts everything below it. So a big trend right now is for people to come in and want to do do filler in their jawline. If you replace the volume in the cheeks, a lot of times you don't need any filler in here or here. It just gives you a whole lot more bang for your buck. It replaces the volume that you're losing in the places where you've lost it the most. And it just makes you look like you, but a couple years ago. It doesn't change the shape of your face. It doesn't make you look different. It doesn't make you look odd. It doesn't give you filler face. If it's done correctly, it just makes you look like you a couple of years ago. So before you go immediately thinking that you want filler in your nasolabial folds or in your jaw or in your jowls, if you're starting to see this, you probably need it here. And like I said, a whole lot better use of your money. You'll get a whole lot more bang for your buck. By the way, in here, it also usually will fix sunken eyes or under eyes. So don't go in thinking that you want under eye filler right away, jawline filler. I would be happy to talk to you more about this regarding your particular face. So come in for a consult if you want to know more. I'd love to talk to you, and I hope this helps.
I like that you ended it